I'm Josh, your guide for Couple Hopes. We will specifically be covering 1. The different types of PTSD symptoms and how they live in your relationship. 2. How the symptoms of PTSD interact with each other and in your relationship to maintain a cycle of problems. 3. How PTSD is a result of stalled recovery. And 4. How you can get better. There are 4 groups of symptoms that make up PTSD. All of these groups impact your relationship. In addition, what is going on in your relationship influences the symptom groups. Our goal is to understand how this cycle of symptoms and your relationship interactions keep you stuck, so that we can stop the cycle that keeps PTSD alive. The first group of symptoms are called intrusive symptoms because they involve trauma intruding on your life. Common ways that trauma intrudes include having nightmares about traumatic events or flashbacks where it feels as if the trauma is happening all over again. You may get very vivid memories of the traumatic event popping into your mind when you feel stressed out or upset, or when you least expect it, like when you're bored. These intruders can be very upsetting for both survivors and partners and impact relationships in a number of ways. For example, you may have started to sleep in separate beds because of the survivor's nightmares. Partners may have gotten involved during a flashback or intense memory to help remind the survivor that they are safe or help calm them down. Partners may also notice that their loved one with PTSD seems distracted or preoccupied because memories have intruded on their mind. These intrusions lead to a second group of symptoms called the hyperarousal symptoms. The term hyperarousal means that your mind and body are hyper or over-activated. They are revving too high. When you are having the intrusions that we just talked about, it can cause you to feel constantly on guard and wired. You may have noticed emotional or body changes that started or got worse after trauma. Some things you might have noticed are intense emotions or body changes like sweating or your heart beating fast when someone reminds you of the event, being unusually jumpy or easily startled, always feeling on guard, and problems sleeping. You may also have noticed feeling more irritable, angry, or cranky, and have started to have difficult emotions like feeling more fear, guilt, or shame. The reason that these symptoms happen after a traumatic event is because reminders cause that similar fight, flight, or freeze alarm response that happened at the time of the trauma. These changes in your body's physical activation and emotions impact your relationship. For example, you may have noticed more conflict in your relationship with more intensity or anger. It may feel difficult to feel close when one or both of you are feeling activated and irritated, or the person with PTSD may feel the need to be in control, and this can make it challenging for everyone to feel safe. The final 2 groups are symptoms that people have to try to escape the prior chain reaction of intrusions and hyperarousal. The first of these are avoidance symptoms, or ways that people try to actively avoid reminders of traumatic events in order to get away from the unpleasant feelings and physical revving. These reminders may be people, places, or things. There also tends to be avoidance of thoughts, feelings, and physical sensations. There are many ways to avoid, such as drinking and drug use, overworking, doing reckless things like dangerous driving, or doing things that can be harmful, like overeating, risky sex, gambling, or hurting yourself. An important thing to know is that partners of people with PTSD sometimes accidentally contribute to the avoidance that PTSD causes because they don't want to make their loved one more upset. We call this tendency for loved ones to allow for avoidance, participate in it, or contribute to it, accommodation. What we mean by accommodation is working around avoidance or making allowances for it, which can accidentally enable it to keep happening or to get worse. For example, you may have noticed that your ability to go out together has changed because the person with PTSD does not want to be in public or around others, or that you have a tendency to avoid sex or intimacy in your relationship because it causes distress. You might avoid people that remind the person with PTSD of their trauma or ask them about it, and so couples often avoid gatherings with family and friends. Other ways of avoiding, like working a lot or drug and alcohol use, can also impact your relationship. The avoidance that PTSD brings is like an unwelcome house guest that takes a lot out of both of you to accommodate. A related group of PTSD symptoms are called the numbing symptoms. People who have been exposed to trauma may have felt extremely afraid, helpless, or horrified at the time of the event. Sometimes these feelings are overwhelming, and in order to cope, a person may disconnect from their feelings. This is another way that people escape from their distress, just like in avoidance. In cases when people are faced with a very dangerous or intensely frightening situation, emotional numbing can be useful. The freezing response is helpful when you can't escape a situation and it is out of your control. the body protectively becomes still and hunkers down for possible injury. Over time, emotional numbing may be used to cope with many difficult situations because it reduces anxiety or distress in the moment. However, numbing blocks an individual from recovering after they are traumatized. Numbing not only gets rid of negative feelings, but positive ones too. This leads to a sense of feeling disconnected or detached from other people, and also makes them less interested in doing things that they used to enjoy because they no longer feel anything when they do them. Of course, these symptoms can show up in a relationship in a number of ways. As we will talk about more later, having less emotion makes communication with your partner about what you're feeling really hard, and so couples may have noticed that they now struggle to express how they're feeling. Sharing feelings is a fundamental way that we connect to others. All of these symptom groups are difficult on their own, but they also influence each other and your relationship. Distressing thoughts and memories about the trauma that enter your mind cause your body to be overactivated and for you to feel challenging emotions. The distress over those memories and hyperarousal makes people want to avoid trauma reminders and numb their feelings. Avoiding and numbing emotions gets rid of distress in the short term, but makes them come back in greater force in the long run. It also prevents the person with PTSD from learning that they are actually no longer in danger and are safe now. Avoidance and numbing lead to more increases in hyperarousal and negative emotions over time. All of these symptoms feed each other and relationship distress in a vicious cycle. With this information about PTSD symptoms and how they play out in relationships, take a moment to consider your specific PTSD symptoms and how they play out in your relationship.